I'm Helen Gravestock and I'm the Associate Director for Policy, Influencing and Voice at Young Lives vs Cancer. I'm also joined by my colleague Sonia Malik, who is our Head of Policy and Influencing. And today we're going to talk through how we at Young Lives vs Cancer work alongside children, young people and parents to make change happen. That's in result from you telling us that you wanted to hear from us. So if you've got any questions at the end, if we haven't answered anything, or if you want more information, then just give us a shout. So what are we going to cover? We're going to talk to you a little bit about what we mean by policy and influencing, tell you how we do things and what we're trying to seek to achieve. We're also going to talk to you about how we do that alongside children, young people and parents, and talk to you about how making change happen with you is a really crucial part of what we do. Then we're going to touch on why policy and influencing is important and how it can impact families' lives. So what do we mean by policy and influencing? I've put a few boxes there to show you what we do to influence policy change. So the first box there is around research and evidence. Essentially, we listen to you, what you need, what you tell us are issues, and we try and shape an evidence base so that we have information ready to lend clouds and weight to the arguments that we make in our policy and influencing work. So we might do that through surveys or focus groups or polls, and we can talk you through that in a moment. The reason we do that is because we're always looking externally. We're doing policy horizon scanning to try and understand what's happening in the external environment. So what's happening in politics, what's happening on the ground in the health system, what's happening in services that we provide. And we do that so that we can apply the evidence and that research that we've done with you to shape our policy positions. So that's about thinking about what we think about the external environment using the evidence that you've given us. Then we go on to use that information and those positions in an active way. So we build relationships. That's a really crucial part of what we do. So we're thinking about building relationships with the people that can help us make that change. So that might be with politicians, the decision makers, those that we elect to represent us. It could be NHS officials or health system officials. And it can also be with other people within the system that we know that can help us make that change for families. We also do lots of public campaigning. So trying to share those messages, those positions that we've been creating with our supporters and working alongside them to make that change. So that might be our petitions, our Ask Your MP asks, trying to work alongside supporters to campaign. And ultimately, the star there is our policy change. That's what we're trying to achieve. So we're trying to use the evidence that we've got to shape positions and campaign to influence positive policy change for families. Put another slide together there to show how families are instrumental to help us do that. So again, it's using what families tell us and using that to develop data. So that could be survey data. From that, we develop key messages. So what do we know about the data? What's it telling us? And how do we apply that against the external environment to give us our policy positions? What do we think about things? We then use that knowledge to put together a series of recommendations, so things that we are asking for, things that can make things better for families. And we use that to campaign. So we use what you're telling us in our campaign messages. And here's just a few examples of how we influence. So that process sets out the whole from beginning to start. And these are some of the activities that we do in that process. So again, it's about developing an evidence base. We do lots of discrete policy work. So working with officials, telling them what we think, telling them what you think to try and influence what they do. We also do lots of public affairs work. So working alongside elected representatives in government across the whole of the UK. And we also campaign. So again, that's about using our messages in a public campaigning way to try and get support for what we're calling for, so that together we can put weight behind our messaging. So I'm going to pass over to Sonia now, who's going to talk us through some of these first steps.
Thanks, Helen. I'm going to tell you more about how we develop our evidence base. Making sure our work comes from a strong evidence base is vital to us. One of the ways we do this is by conducting our own research alongside children, young people and families. In the past, we've done lots of social research with those we support and others through interviews, focus groups and surveys to help us understand the experiences of children and young people with cancer. We also gather insight from our social workers and other services colleagues and NHS professionals. We use all this information to develop our policy positions, target things we can change, raise awareness and have robust evidence to take to policymakers such as MPs. Alongside this work, we also contribute to the wider evidence base by promoting research that's being done by others and getting involved in projects like the James Lind Alliance Priority Setting Partnerships that some of you may know about or have taken part in. Currently, we're involved in the Children's Cancer one, funded by CCLG and the Little Princess Trust, the aim of which is to agree priorities for unanswered research areas that are important in children's cancer. An example of one of our previous research projects is our cancer costs research in 2016. From talking to families and our social workers and scoping the academic literature, we knew that there are lots of financial costs due to childhood cancer, but we also knew that there was limited research exploring these financial costs in children and young people, particularly in the UK. We conducted 2 surveys. One explored the experiences of over 16-year-olds who had cancer before the age of 24. The other was for parents financially responsible for a child or young person under the age of 24 when they had cancer. We also conducted 5 interviews with parents, 5 with young people and 7 with click sergeant social workers, as we were then. We found that cancer can cost an additional £600 a month for families, and that those costs are made up of travel, food, clothing, hospital parking, amongst other things. This formed the basis for many years of our campaigning and influencing work, including the development of our campaign for a young cancer patient travel fund to help with the costs of travelling to treatment. A great approach we were able to try out with a research project a couple of years ago was the Young Researchers Group, who helped us to design and deliver a research project about the experience of cancer and employment for young people and parents. We wanted to make sure that young people's voices were heard at every stage of the research, that it started and continued with their voice. We had a group of 14 young people and we supported them with some research training. Let's listen to them tell you about it themselves.
Hi, I'm Kiva, I'm 23 and I'm from Belfast.
And I'm Emily and I'm 25 from Birmingham.
Click Sergeant does research differently.
We're part of Click Sergeant's Young Researchers. This team is made up of 16 to 25-year-olds who have all had experience with cancer and we're from all different areas in the UK. The project is funded by Société Générale.
So for the past 10 months, we've been designing, conducting, analysing and presenting research based off of surveys and workshops in preparation for delivering a report exploring the impact that cancer has on young people, parents, carers, in terms of their experiences of employability and employment opportunities.
Our research found that half of young people who were in employment had to take unpaid leave during their cancer treatment. So when I was going through treatment, I had to have a couple of months off for my radiotherapy, and I was told initially that this would be unpaid. I eventually ended up emailing and speaking to people that were higher up in the company to explain my situation, and in the end I managed to get 3 to 4 weeks of paid leave, but it meant that all the time off after that was unpaid. I'm not alone. Our research found that a lot of young people returned to work before they felt ready. 80% of people did this because they needed money.
One of the aspects of our research showed that 3 out of 5 young people felt that they had missed out on employment opportunities due to their cancer, which I've experienced myself because when I was diagnosed with cancer, I couldn't work for 2 years, which then left a massive gap in my employment history and meant that the field of jobs that I could apply to was significantly narrower because many required several years of experience, which I didn't have. It made me feel at a real disadvantage in comparison with my peers. It made me feel that I wasn't maybe moving as far ahead in life that I would have liked to.
This is only a small part of our findings. You can read our full report on the Click Sergeant website.
To see what we have to say about it.
We also talk to them, employers, parents, to develop some toolkits for employers so that they could better support employees who had cancer when they were a young person or a parent with a child with cancer. Another element of our work is discrete policy work, when we're asked by those in the sector, often the NHS, to engage with policy agendas and advise or contribute to key areas of work, projects or plans. We most often engage with officials in the health system to do this. Our place in these conversations is to bring the voice of children, young people and parents, and to make sure that their needs are represented. We try as much as possible to make sure that it is actual engagement with families rather than just us attending meetings and speaking for them. And we do this by facilitating conversations, events, surveys, or consultation responses. An example of one of these pieces of work is for the Under 16 Cancer Patient Experience Survey for England. You may know that there is currently an adult cancer patient experience survey for over 16-year-olds in England, but that the voices of children and families has been missing from this kind of data collection. And this data helps trusts and the NHS see the experiences that people are having and aims to help improve services and outcomes. Young Lives vs Cancer and others in the sector have been influencing for years for this survey to be developed, and now it's live for the first time, currently collecting data. This has been a long time coming of us and others highlighting the gap, supporting the development at all stages by lending our experience and insights and connecting the patient experience team at NHS England to children and families. And we'll continue to develop that relationship so that we can keep bringing your voice in.
We also do public affairs work. So we do this alongside children, young people and elected representatives. We work with MPs, for example, to gain their support so they can help champion our policy asks and our call for change. In the middle there, you can see a logo for the all-party parliamentary group on children, teenagers and young adults with cancer. So that's just one way that we work with MPs in Westminster so they can listen and hear from children and young people with cancer, and so that they can join us in terms of our policy and influencing work to make positive change for them. On the left there, you can see a report called Listen Up, which is as a result of an inquiry that we did with young cancer patients so that we could understand what's important to them, what change they want to see, and the recommendations that we can put forward to government to together be calling for that change. We might also meet with MPs and ministers. We might brief them ahead of debates, and we might give them questions to ask and table in the parliamentary questions. And we do this alongside children, young people and parents. So we might ask them to email their MP, to ask for meetings. And if we secure those meetings, we always try and do those alongside children, young people and parents. On the right there, you can see an article in the news where a young woman called Helen, who lives in Boris Johnson's constituency, wrote to her MP so that she could raise awareness of what was important to her and what was important to other children and young people with cancer.
And here is Helen Hart reaching out to Boris Johnson in a video clip on Twitter.
I'm calling out to you, Boris Johnson, as my MP and Prime Minister. I was diagnosed with a blood cancer at 20 years old. Going through cancer treatment as a young person is extremely isolating and lonely. Click Sergeant were there for me every step of the way, practically, financially and emotionally. Without them, I would have been lost. Click Sergeant have been severely impacted by coronavirus, and now I'm calling on you to help them to continue to support children and young people with cancer. They are asking the UK government to provide them with £750,000, which will continue to help provide vital care and support to around 1,200 families at any one time for up to 6 months. Click Sergeant support is a lifeline for families just like mine. Please don't let children and young people be forgotten during this pandemic.
She was very helpful for us in terms of raising some of the issues that we were calling for at the time. So Rachel Kirby-Ryder, our CEO, accompanied Helen and was able to champion some of the asks that Young Lives vs Cancer wanted the government to hear. We also share stories of constituents with MPs with their consent so that they can hear what's happening on the ground, what's happening to the people in their local area. And we also do the same with statistics and data. So we tailor that information according to the local area that an MP might represent. We also do lots of campaigning, so public campaigning, and we are committed to ensuring that children, young people and parents are a really key part of that. All of our asks are embedded in what they tell us, and they're really instrumental in helping us to share those campaign messages. So that might be via our communications, our social media, our videos, and like I say, through our policy and influencer meetings. They're also really crucial to help garner that support. So again, via petitions, consultation responses, emailing their MP, we really need their help to make that change. And the Cancer Cost campaign that Young Lives versus Cancer here is as an example of how we've done that alongside parents and young people. So again, they signed our petitions, they emailed their MP. And on the left there, you can see a group of children and young people accompanying us to Downing Street to hand in one of our petitions that was calling for change. We also work really closely with other organisations. So as an organisation, we are committed to working with others. We think that this makes our voices louder and we can make more impact this way. CCLG and Young Lives are committed to ensuring that intelligence is shared, for example, between both organisations. And we've got a new clinical insight partnership to help us do some of that. Both CCLG and Young Lives versus Cancer are also part of the Children and Young People's Cancer Coalition. So it's a wider group of charities that come together to share intelligence, to share best practice, and to come together to make children and young people's voices louder in the cancer sector. Young Lives versus Cancer also has a few partnerships with other organisations so that we can make our voices louder and make more impact for children and young people. So for example, we have a partnership with the Ellen MacArthur Cancer Trust and another with the Teenage Cancer Trust. And so some of our policy and influencing work has become an important part of those partnerships. Here's an example of our Hand to Hold campaign that we undertook with the Teenage Cancer Trust. So this was undertaken earlier this year, and it was as a result of young people telling us that they were facing hospital treatments alone. So we were campaigning so that they could have a hand to hold during the COVID-19 pandemic. We did this with children, young people and parents, so we collected evidence from them. We asked them to sign our pledge, which was calling for all young people to have a hand to hold. And we supported young people to tell their stories in the media. As a result, we were able to meet with ministers across the UK, and we developed guidance for young people so that they can have a hand to hold during cancer treatment.
Why is all of this so important? Well, that's because it can create long-term impact and change for children, young people and families' lives. For example, Young Lives versus Cancer were involved in the campaign and influencing work which brought about commitments to abolish funeral charges for children's funerals, and those schemes are now being implemented everywhere except Northern Ireland, which we're working on. And this can make a real impact to families at the worst of times. As I talked about earlier, the Under 16 Cancer Patient Experience Survey is now collecting data, so soon we'll be able to see what this data says about children's experiences and how we can use that to make things better. A few years ago, we secured commitment from the Labour Party, should they come into government, for a young cancer patient travel fund, alleviating the costs of travelling for treatment. And just a few months ago, due in large part to our campaign for the travel fund and our relationship with SNP MP Amy Callaghan, Scotland introduced their family fund to help with the costs of inpatient treatment for children. We've developed partnerships, awareness, and better vulnerable customer treatment and policies with private companies. For example, developing a referral system with British Gas for those we support. And that brings us to the end of our presentation. Thank you so much for listening. We're really looking forward to answering any questions you have on the way we take evidence and data and voice to decision makers to make change in the system. Thanks for listening.